morning again, ladies and gentlemen. We come to you with this our 20th video presentation for you in this process. And I think, as I mentioned on Tuesday, we started back on March the 24th. And if we go to next week, in June, we will have been bringing these videos to you in parts of 4 months. And we're presenting issues and people that are involved in this, a lot of advice and direction and sort of best practices for you, the public, and I hope that you're taking something from that and that it helps you. Well, we have come through the Memorial Day weekend, and that's sort of the traditional start of summer, and I guess summer will be a little different for all of us as we learn what we can and can't do, again, those best practices as we go through the summer months. I've had a haircut, so maybe some of you guys are getting haircuts, and the ladies are back in the hair salons or the nail parlors, and those things that are opening up that we've wanted and we've asked for. And so it's up to us now to how we proceed with those openings and how we take advantage of it and the protection that we continue to provide through self-discipline as we learn to work with more of these openings. I've been to a couple of my favorite restaurants that did open up on a limited basis, and people seem to be taking it seriously and seem to be following the protocols that are being asked for to protect, and that's a lot to avoid the liabilities that would go if they didn't do that. So I hope that you can enjoy some of those additional freedoms and do so responsibly. We have 636 cases or individuals this morning that have been affected by the virus. Again, the expanded families that go with that, and unfortunately 12 deaths. We had 12 deaths just a few minutes after we ended our video back on Tuesday morning. So that's the bad news again of this process. And I thought, sort of on a personal note this morning, I've been blessed. I have family sort of spread out. I have a daughter her family lives in Atlanta. Her daughter, my granddaughter, recently married, and she's in med school down in Savannah. And her new husband works for the fire department in Savannah, Georgia. And they are all healthy and doing well. My grandson, again a newlywed, he and his wife, doing well. My daughter was up here in our area for the weekend, and always well with them, and so grateful. I have a grandson in UNC Wilmington, and he lives down there, daughter at State, but everybody's doing well, and we're most grateful, and we give God thanks for his safety. And while these numbers are comparatively large, there's still a lot of families that have been blessed and have been able to avoid the coronavirus. And if you're among those, we certainly collectively want to give thanks and recognition from those who take care of us in the medical profession, these EMS workers, first responders, the doctors, hospitals that administer and take care. So be thankful and appreciative as we go through this. This morning, for a little spiritual thought, I read my Bible some every day, try to, and different scriptures come to mind. I was looking last night in the book of Isaiah, which is the first of the major prophet writings in the Old Testament. Isaiah's name means salvation of the Lord. It's a long book, 66 chapters in the book of Isaiah, and he talks about everything from the creation to the establishment of the new heaven and the new earth. He covers the birth and the life, the death, and the future reign of Christ on earth. In the 9th chapter, 6th verse, this is 700 years before Christ was born. And Isaiah wrote, "For unto us a child is born, unto us a son is given, and the government shall be upon his shoulders. And his name shall be called Wonderful, Counselor, the Mighty God, the Everlasting Father, and the Prince of Peace." Isaiah's writings are listed, and no other prophet writer wrote with such eloquence about the glory of God as did the prophet Isaiah. He prophesied in the southern kingdom of Judah, the two tribes that separated from Israel. There's no other place in Scripture written under the law where there is such a clear view of God's grace. And I wanted to read a couple of verses of Scripture that were sort of jumped out at me, and they're marked in my Bible that I have referenced and made note of over the years. The 41st chapter in the 10th verse, Isaiah wrote, "Fear thou not." This is God talking to his people. "Fear thou not, for I am with thee. Be not dismayed, for I am thy God. I will strengthen thee. Yes, I will help thee. And yes, I will uphold thee with the right hand of my righteousness." And in the 40th verse, in the 40th chapter, in the 30th verse, Isaiah says, "But they that wait upon the Lord shall renew their strength. They shall mount up with wings like eagles. They shall run and not be weary, and they shall walk and not faint." I think these are appropriate words, appropriate scriptures for the circumstances that we're in right now with the coronavirus. And it's appropriate at this time for us to have strength, draw strength from these scriptures. And for us to be patient and to wait upon the Lord. And as I said a few minutes ago, a lot of families have been directly affected, but a lot of us have been blessed. And we certainly want to be grateful for that. So as we go forward, let's continue to remember who our neighbor is and be thankful for what we have and help and invest it as we can to keep the rest and to keep all of us as safe as possible. So thank you as we come to the end of the month of May. Thank you again. We're getting good responses from our videos. We thank you for watching. We have presenters today that I think again will give you some good information again as we face the summer and swimming pools open and that sort of thing, and keep these in mind as those safe practices. I will remind you, starting today, we have a new policy or program here in the county. It's called "Need a Mask? Just Ask." And you can find those are being distributed at the Recreation Center in Archdale, at City Hall in Randolph, at the Department of Social Services, and at the Public Health Department. Possibly we have one over in Liberty if we get some response back from that area. So if you need a mask, just ask. And thank you again for watching, and God bless.
Good morning. I'm Susan Hayes, Randolph County Public Health Director. Today at 9 a.m., our total case count was 642 with 12 deaths, 414 released from isolation, and 16 hospitalizations. Today I want to remind parents that we are still encouraging childhood immunizations. During this time of stay at home, in-person interactions have been greatly limited. If children get behind on immunizations, it increases the risk of contracting diseases like measles as we begin to interact with others. Well child visits and immunizations continue to be important and critical to protecting children's health. Now is the perfect time to get your children's vaccinations. Vaccinations protect everyone from dangerous, potentially deadly diseases such as measles, polio, influenza, tetanus, and diphtheria. Families should contact their healthcare provider to discuss well child visit options and how to keep their children's immunizations up to date. The health department continues to offer immunizations by appointment. The number to call is 336-318-6200. What we don't need during this time is another outbreak. Children are our most precious treasures. Please protect them now by making sure they receive the preventive care and the vaccinations they need to stay healthy. And remember, wear a mask, wash your hands, and wait 6 feet. Stay safe. Thank you.
Thanks again, Commissioner Darrell Fry and Public Health Director Susan Hayes, for your comments and those updates on the coronavirus and its many impacts on our Randolph County community. It's hard to believe that this is Randolph County's 20th video, which we began back in March the 24th, and they're designed, as always, to provide you with up-to-date information and insights, not only on the status of this coronavirus pandemic, but also how the departments and the agencies of Randolph County government provide the services you require during these challenging times. Over 22,000 people have viewed our videos, and we thank you for that, because information in a time of a crisis can be a citizen's most valuable resource. We've used these videos as an opportunity to spotlight many Randolph County departments, agencies, and organizations, all of which have a unique role in the many challenges faced by your county government in this time of pandemic. And today, our next update will be presented by Wayne Jones. Many of you know Wayne. Wayne is the supervisor of the Environmental Health Division of the Randolph County Health Department. The role of environmental health is critical to maintaining the health and safety of our community. The professionals of our Environmental Health Division work with the public to identify, inspect, and investigate environmental problems that affect our public's health and well-being. They conduct annual monitoring inspections to establishments around the county that serve the public to ensure public health safety for those citizens who interact with the business. At no time in our history has the role of environmental health professionals been more critical than during this time of global coronavirus pandemic. Wayne's now going to update you on just a few of the roles performed by our environmental health professionals.
I'm Wayne Jones, Randolph County Health Department Environmental Health Supervisor. Our section of the Health Department is responsible for inspecting public swimming pools, tattoo parlors, tattoo businesses. Public swimming pools include swimming pools, spas, wading pools, and interactive play features such as splash pads. As you may be aware, the governor has allowed those facilities to open as of May 22nd. And in light of that executive order, the Department of Health and Human Services has released some guidance documents. I want to talk to you about those today. The guidance documents are in addition to the rules that these facilities operate under. They're not in lieu of. So these are additional steps that the operators and owners of these facilities will implement to try to keep you and their employees safe during this time. The guidance document has a wealth of information. Some are requirements and some are recommendations, but today I just want to speak on 4 main points. That is social distancing. We're all familiar with that term at this point. The use of face coverings or face masks, additional cleaning and hygiene, and the monitoring for symptoms of the employees. So first we'll talk about social distancing or physical distancing. We've heard it countless times. We need to be 6 feet away from other people. We have done these steps to try to keep the spread of the COVID-19 coronavirus in check. So part of the guidance document is we're reducing the number of people that are allowed to be in swim pools, on the decks, and in the tattoo businesses. So the capacity has been reduced. So for the requirements for swimming pools, the occupancy is no more than 50% of the established fire code occupancy. And if you don't know what that occupancy is, then an alternative method for determining your occupancy during this time would be 10 people per 1,000 square feet of pool area, water, and 33 people per 1,000 square feet of deck space. So that works out to about 100 square feet per person in the water and around 30 square feet per person on the decks. Pools are required to post this new maximum occupancy, and then they're responsible for maintaining those numbers and not allowing overcrowded situations. They're also required to post signs reminding people to social distance. The recommendations for how they are achieving this are maybe making appointments, scheduling different times for people to use the pools, to space the chairs out on the deck so that they're not closer than 6 feet. Discontinue the use of shared tables unless it's a family. A family unit can share a table, and they're not required that social distancing, same concepts. The lifeguards, we recommend that they have a area that's designated where they are and there's nobody within 6 feet of them during this time. And also to remove any exercise equipment or pool toys or things that get shared. We also have social distancing requirements for tattoo establishments. They're to limit the occupancy to same as 50% of their established fire code occupancy, or no more than 12 people per 1,000 square feet. They also have to post the signs for their new occupancy, to arrange the seating in the waiting room, to provide adequate social distancing, and to mark off 6 foot on the floors at the high traffic areas like the cash register or the counter, where they discuss their options with their tattoo artist. There's also recommendations for tattoo establishments, signs on the doors recommending that the clients wear face masks. We consider closing the waiting rooms and do an appointment only, or have the people wait in their car and you can call them when their time is available. We also recommend that they have the windows open as much as possible, use fans, just being sure that they have good ventilation so that the air is moving around. The second thing we want to talk about is the use of face coverings or face masks. For public swimming pools, there are no requirements for face masks, but we do recommend that the employees wear face masks when they're going to be closer than 6 feet to people. We recommend that the patrons using the pool wear face masks as they're entering and exiting the pool area, as they're coming from their cars and going back to their cars. And when they're not in the water, when they're on the deck, the use of face masks could be helpful too. At tattoo establishments, there are requirements for the employees at a tattoo establishment to wear a face mask, and we recommend that everyone wears face masks because of the close proximity during the receiving of a tattoo or giving a tattoo. We recommend that these tattoo establishments provide face masks for people who show up and don't have them. And they need to be single-use face masks, or if they are cloth face masks, they need to be washed in hot water and dried on high temperatures. The second thing we want to talk about is the cleaning and the hygiene. For public pools, we recommend that they use an EPA-approved disinfectant on all the high-touch areas, such as the counters, the handrails, in the bathrooms, to be sure that any hard surfaces are disinfected throughout the day. We recommend that they provide hand sanitizer stations throughout. If they have a snack bar, we recommend it be closed at this time, allow people to bring their snacks. Have employees wash hands immediately upon arriving at work, and provide for some pools that don't have lifeguards or don't have attendants, such as motels and things like that, apartments, we recommend that they provide disinfectant wipes or solutions with instructions on how and when to use them, and provide those for the patrons of the pool. And if you're at a pool that provides a towel service, those towels need to be kept in a closed bin, handled as little as possible, and then washed in hot water, dried on high temperatures, and the employees need to wash their hands immediately upon touching those towels. For tattoo establishments, the cleaning and hygiene is pretty commonplace. Our tattoo artists are very adept at the cleaning and disinfection processes, as that's part of their rules. We recommend they use an EPA-approved disinfectant for their cleaning, one that is capable of killing the coronavirus. The high-touch areas need to be cleaned before and after each use, which is part of their rules and process, so most of that's not going to be a change. The one thing that they need to be more cognizant of is cleaning the waiting areas and the counter areas where the payments are made. Have those areas cleaned throughout the day. Tattoo artists are used to cleaning their room and their equipment, but paying special attention to those waiting areas where customers frequent is an important part of this time. It's also recommended that the tattoo artists provide hand sanitizer stations to their patrons to allow them to disinfect, sanitize their hands when they come in, and then also if there's a public restroom available to them, to have soap, clean single-use paper towels to clean and dry their hands. The last thing I want to talk about today is monitoring of symptoms. This is primarily for the employees and the staff at these establishments. These establishments need to conduct daily symptom screening for employees. Typically involves a questionnaire, taking of temperature, and then document that. If someone arrives with symptoms, they need to be isolated immediately, removed from the facility, preferably given a face mask in order to leave and to isolate. And then posting a sign on the door to notify the patrons or those using the establishment that they should not enter if they're having symptoms, and list out what those symptoms are. It's recommended that you have a plan in place in case this happens. If someone comes to work with a high temperature or has a cough, how you're going to isolate them and what plans you're going to do for disinfecting and closing during this time, if necessary, to clean and have everything disinfected to protect everyone using the facility, whether it be staff or patrons. Follow the CDC guidelines for the employees who have tested positive for the COVID-19 virus, and then follow the CDC guidelines for the disinfection after someone has been tested positive. There's a tremendous more information that's available. There'll be a website posted at the end of this video. You can go to that website for the complete guidance documents. If you have questions, you can call the coronavirus hotline, which number will be listed at the end of the video. Thank you for your time.